This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Introduction. As a healthcare manager, the most important healthcare functions that a manager can play include leading, organizing, planning, and controlling. This involves reporting to the board members and briefing them about the progress in the organization in terms of potential profitability, costs, patient care, and any setbacks. Planning. In planning, the healthcare manager is expected to set fundamental goals such as the number of patients served, services given to the patients, developing coordination between the healthcare facility and the hospital to ensure that the hospital gets referrals from the available physicians and ensuring that sufficient staff is available in respect to the number of patients available. As a manager, one is also expected to set out a plan to ensure that time is used properly and financially coupled with bookkeeping staff can work with health insurance companies such as Medicaid and Medicare in making patient payments. The manager is also expected to plan for emergencies, particularly in the case of a sudden influx of in-home patients who might hire speech therapists temporarily. Organizing. As a manager, one should also be able to counter one of the major challenges in healthcare service, which is organizing services and staff. The managers should ensure that the in-home calls to be made are on schedule, and in case of delays such as therapist or nurse absence, contingency plans are available to ensure that all patients are given quality care. Leading. A manager should also take the role of a leader, implying that he should be able to motivate and influence the employees towards the attainment of the healthcare objectives. For a manager to be a good leader, there is a need for him or her to be an effective communicator with subordinates to leave them motivated. For instance, the health manager should form teams and hold regular meetings with employees or teams to discuss the organization's issues and problems facing them, such as economizing time, patient relations, taking care of emergencies, staff-staff relationships, and patients' relationships with physicians. The manager is also expected to lead by example, and to do this, he is occasionally required to join the staff during their work session and help them. Controlling. Controlling entails ensuring that the services given do not deviate from the expected standards by establishing the performance standards, carrying out a comparison of actual performance and standards, and coming up with corrective actions. To ensure that the performance standards do not deviate, the health manager should be able to take control. He or she should ensure that medical doctors, nursing supervisors, and administrative assistants are obligated to report to him any issue of healthcare services. Conclusion. All the management factors draw up to job satisfaction, and therefore, good leadership is the most important aspect of healthcare management. With good leadership, one can build strong teams which form the basis of any organization's success. The teams that are under good leadership will be able to contact the physicians, local hospitals, and agencies in an attempt to make sure that they use the organization's healthcare professional services, attend to emergencies on time, and offer the organizational support that the healthcare organization needs. Did you like this healthcare management, planning, organizing, leading, controlling sample? To get more works like this one, make sure to check out the free database of academic paper examples at ivypanda.com. You will find thousands of samples for all your study needs, without even having to register.